Greetings, everybody. I'm Dr. Vikas Chopra. I'm the HOD Cardiology at Primus Super Speciality Hospital. So today I will be discussing a little bit about the process of procedure of angioplasty and what to expect after angioplasty. So as everybody must have heard, angioplasty is very common these days. It's a procedure in which we open the blocked arteries of the heart without surgery, without any incision, without any stitches. So this is basically a lesser invasive of the two procedures to open the arteries of the heart, the other being coronary artery bypass surgery, which is, as you everybody knows, it's an open heart surgery. So angioplasty involves the process in which first we do angiography, which is the X-ray of the arteries of the heart. In that we come to know that where are the blockages in the arteries. And then if we decide to go through with the process of angioplasty, in the same sitting or in a subsequent time, we thread a wire into the arteries of the heart. And over that wire, we thread a balloon, a small balloon, and after we dilate the blockage, we put a small mesh-like structure called stent. So this is basically the, in nutshell, how the process works. So after angioplasty, since it is a non-surgical procedure, we shift the patient to the coronary care unit where we observe the patient for about 24 to 48 hours. After the procedure, if the patient is stable and the patient is on medication, then we can discharge the patient after 24 to 48 hours. Usually we do this procedure from the wrist artery, the radial artery, and sometimes we rarely perform it through the groin, which is the femoral artery. If we do the procedure from the wrist, then we can safely discharge the patient after 24 hours or sometimes after 48 hours. After angioplasty, the patient doesn't have to take any specific precautions. He can resume his normal day-to-day activities after 3 to 4 days. Important thing is to continue to take the medications which we prescribe, because after stenting, the blood vessel is flowing, but then stent surface is exposed to the blood. So we don't want a clot to form in that place. So we give medications for that, which are called antiplatelet medications. So we advise the patient to continue these medications for as long as we prescribe him. And then the patient comes for follow-up after 2 weeks. And after that, we typically call the patient after 2 to 3 months. And after that, after angioplasty, the patient is free to do whatever the normal activities the patient was doing. He can do his walking, he can do regular work, he can join his whatever work he was doing prior to that. Only thing is that he has to modify his lifestyle, because as we all know, cardiac diseases are basically lifestyle related diseases. So lifestyle is a very broad term, which basically means the kind of food that the person eats, the kind of exercise the person gets, and the kind of other habits which the person may be having, for example, smoking and drinking, which we typically prohibit. As far as the food and exercise are concerned, we advise the patient to have as much of whole grains, fruits, vegetables, and less of fat, less of oil, and avoid the processed food basically, and food from outside like the bakery products and other such stuff. Exercise is very important. We typically advise a patient to do about half an hour to 45 minutes of light exercises every day, which may involve walking or brisk walking or even light jogging. And as per the patient's comfort level, the patients can increase the quantity of exercise over a period of time. So both these things, exercise and food habits, they go a long way in preventing the recurrence of the disease, along with the medications which we usually prescribe depending upon the patient's underlying conditions. Thank you.